Constipation, you could say it's a disease or you could say it's a symptom. A symptom is also fine because many diseases have constipation as a symptom. Diseases mainly characterized by constipation are also very common. Clinically, it's very common, I should say. Today is the Double Ninth Festival, also known as the Senior Citizens Day. During the Han Dynasty, Wang Chong wrote a book called Lun Heng, in which he mentioned, if you wish to live long, keep your intestines clear. If you wish not to die, keep your intestines free of impurities. Impurities refer to residue. Having no residue in the intestines highlights the crucial role of maintaining smooth bowel movements in health preservation, especially for the elderly. Don't underestimate this matter. Some people think constipation is just constipation. Not a big issue, right? Others go once a day. I go every 3 days, not a big problem. If you suffer from long-term constipation, the accumulation of toxins, in many young people, it manifests as acne and pimples. For some elderly people, the harm might be greater. Maybe you can't see it, but it may increase the risk of colon cancer. With an aging population, everyone desires to be healthy and live long. To be healthy, it's essential to maintain smooth bowel movements. Constipation can be classified into many types: cold constipation, heat constipation, qi constipation, deficiency constipation, right? Within deficiency constipation, there are also qi deficiency, blood deficiency, yin deficiency, and yang deficiency. Different types of deficiency require different formulas. So this is a strength of Chinese medicine in treating constipation, syndrome differentiation, and treatment. Earlier, teacher Xiang mentioned Jichuanjian, which is Zhang Jingyue's prescription. Of course, historically, there's another version of Jichuanjian using Dangui and Rukongrong, which is warm in nature. There's another treatment for cold constipation, substantial cold constipation, which is Da Huang Fu Zitang. These are treatments for cold constipation. If it's yin deficiency, you can use Zheng Ye Tang. For blood deficiency constipation, he uses Ran Chang Wan. For qi deficiency constipation, we might use Wang Qi Tang. So for different types of constipation, there are different prescriptions and different treatment principles. Actually, simply relieving constipation is very easy and simple. I believe there's no constipation that can't be relieved. So why do we still need to differentiate and do syndrome differentiation? This is a matter of treating the symptoms in the root cause. Syndrome differentiation and treatment address the root cause. Based on the underlying cause, if it's just been a few days without a bowel movement and I want to relieve it immediately, I use rhubarb Da Huang. It quickly solves the problem. Senna leaves also work. During my master's studies, I researched spleen deficiency, creating a spleen deficiency model in mice by feeding them Da Huang, raw Da Huang decoction, which surely causes diarrhea within 3 days. Then I usually feed them for 7 days to make them develop spleen deficiency through diarrhea and then treat them with Chinese medicine. So Da Huang's laxative effect is very strong. Another one, senna leaves, I often use them and prescribe them to patients frequently. No matter how severe the constipation, once the dosage is sufficient, Da Huang and senna leaves can provide symptomatic relief. So why do we still need to practice syndrome differentiation? The reason we stress syndrome differentiation is that simply relieving constipation is easy. But if you stop taking it, the constipation returns, you can't maintain it. Is it okay to take it long term? No, then taking it long term will cause spleen deficiency, just like those mice. Da Huang caused spleen deficiency through diarrhea, right? Another thing is that long-term use of laxatives can lead to colon melanosis. Whether it's senna leaves or Da Huang, many laxatives contain a common component called anthraquinones. These anthraquinones and their derivatives have a definite effect on constipation. However, these anthraquinones can also lead to colon melanosis. I once worked in the endoscopy room, collaborating with them there for a period of time. Those who take laxatives long-term, not necessarily Chinese medicine, Western laxatives could also cause. The colon's inner lining turns black, which is known as colon melanosis. Of course, stopping the laxatives can reverse this, but long-term use poses a risk of cancer. Therefore, in Chinese medicine, we can treat symptoms for substantial constipation using Da Huang or senna leaves for quick relief. For deficiency, treat the root cause. For deficiency-type constipation, elderly constipation, postpartum constipation, and constipation due to chronic illness, we need to slowly treat the root cause.